Okay, in this lesson, we're going to talk about cognitive impairment disorders. So there's actually 4 things that fall into this category: autism spectrum disorder, attention deficit hyperactivity disorder or without hyperactivity, dementia, and Alzheimer's disease. Now, ASD and ADD and ADHD are discussed in the PEDS course. So here in this lesson, we want to focus specifically on dementia and Alzheimer's disease. So first, we want you to understand that there's multiple types of dementia, and they all have slightly different presentations and progressions, but these are the general characteristics. So dementia is a gradual progression of cognitive decline that ultimately affects the client's ability to function in normal life. So while some types will progress faster than others, it is still gradual, and we're talking months to years. We're not talking days to weeks. We're still talking quite a long period of time. So clients will start to experience self-care deficits. They're going to struggle to perform their normal ADLs or even, cook for themselves. They'll have impaired judgment and problem solving. They especially lose those complex problem solving tasks first. And then as time goes on, they'll start to lose the simple tasks as well. And that we may even see some behavioral changes as their cognition declines, and they may even get aggressive. Now, sometimes the aggression is out of fear or anxiety, and sometimes it's because, their nerve connections are just not firing like they're supposed to. Now, when we talk about Alzheimer's, it's actually a type of dementia. So all patients with Alzheimer's have dementia, but not all patients with dementia have Alzheimer's. So to remember it, sometimes I'll actually say, instead of saying Alzheimer's disease, I'll say Alzheimer's dementia, or I'll say Alzheimer's type dementia, just to help me remember that. So Alzheimer's is an irreversible condition of nerve cell deterioration. So you can see in this image, there's extreme atrophy or shrinkage of the cerebral cortex. That is where the majority of our thoughts and our memory is processed. So if you don't remember anything else about Alzheimer's, remember this picture. Remember what this cerebral atrophy looks like. And then you can imagine all the struggles that would come along with losing all of those nerve cells. So what we see is a steady, progressive decline in functional capacity. Remember that there is no cure. It is irreversible. So the 5 hallmark signs of Alzheimer's type dementia, we call them the 5 A's, are apraxia, aphasia, agnosia, anomia, and amnesia. So let me explain each of these. Apraxia is a difficulty performing motor tasks. They'll start to lose fine motor tasks first, and then eventually they'll move to more gross motor tasks that they aren't able to do. Aphasia is difficulty with speech and recognizing language. So it might be that they can't speak or that they don't understand what you're saying. Agnosia is when they don't recognize familiar people or objects. So here's how I remember this. Have you ever been out at a store or something and someone waves at you from across the store and you're like, do I know you? Obviously, that guy knows you. Get it? Okay, so remember, when we put an A in front of something, it means not, right? So if in Alzheimer's, they see your face, but they don't know you. Okay, so that's agnosia. Now, anomia is similar, except it's a difficulty remembering the actual name of the object. So they may say, oh, I know who that is or what it is, but I can't think of the name of it. Even looking at an apple, something they've seen and known their whole lives, they're going to struggle to come up with the word apple. And then finally, amnesia, that's memory loss. Typically, we'll see short-term memory go first, and then eventually the long-term memory. So they'll remember a story from when they were 12, but they can't remember what they had for breakfast. Okay. So remember that this is a gradual decline, steady decline. So it'll be little things at first, like forgetting to turn the stove off or where their keys are. And then it'll progress more and more until they can't even remember how to walk or talk or feed themselves. So there's four main nursing priorities in clients with Alzheimer's and with dementia. The first is safety. Many clients have a tendency to wander. So we'll use, alarms in a lot of facilities. Sometimes they'll have a little bracelet on that if they go through the door, it alarms. Or I always recommend that clients with Alzheimer's wear, a medical alert bracelet that has their name and maybe a phone number, maybe an address, so that if they were to go out on a walk, they have emergency contact information and somebody could get them home. Because sometimes they literally go for a walk that they would go for all the time, and then they just can't remember how to get home. So it's really important. We also want to be cautious with water temperature, toxic materials in the home, because judgment is impaired, and so they may not recognize the danger. And then as they get more and more apraxia and issues with those motor movements, they're going to be a high fall risk. Now, we also see a lot of agitation and sundowning in later stages, where their symptoms are worse in the evenings and their confusion and agitation is worse in the evenings. So we just want to decrease stimuli. We're going to reassure. We can reorient as needed. And then we just never argue with them. All that does is make it worse. It makes the agitation worse. The third priority is communication. So always be calm, firm, and direct with what you need. Stand right in front of them and talk to them. Use simple 1 or 2 step directions. You don't want to give them complex instructions because they won't be able to follow. Always identify yourself and tell them what you're going to do, and then reorient them as needed. This just cuts down on that overwhelming confusion. And then finally, we want to promote independence for as long as possible. So we want to have them perform their own ADLs as long as they can. Familiar tasks or games, maybe there's a card game that they really like, that they're good at, that they remember how to play. This is all about routine. The routine can really help them, remember what to do. And then allow time for reminiscing. Like I said, they're going to remember stories from their childhood for a long time. So allowing them to talk about the things that they do remember gives them a sense of security and safety. Finally, I just want to point out that we need to provide a lot of caregiver support as well. There's going to be role strain as we see adult children taking care of their parents. Make sure that we're clear with them about the progression of the disease. Give them tips and tricks for how to communicate effectively with their loved ones. And then, of course, there's always respite care options that allow them a break from this 24/7 care. This is so beneficial, and I see a lot of caregivers not using it because they feel guilty. And so you need to let them know there's nothing wrong with taking a break because they have to care for themselves as well. So priority nursing concepts, as we already talked about, safety, aspects of cognition, and communication. So let's recap quickly. Dementia is an umbrella condition of gradual cognitive decline. Alzheimer's is a type of dementia that involves progressive and irreversible nerve cell deterioration. Remember that cerebral atrophy you saw. The 5 hallmark signs of Alzheimer's are the 5 A's: apraxia, aphasia, agnosia, anomia, and amnesia. Motor issues, speech issues, he don't knows ya. Anomia, can't name it. Amnesia, can't remember it. Our nursing priorities: safety, watch behaviors, communication, and promote independence. And then just remember to provide support to the caregivers as well, because this can be emotionally and physically exhausting. Okay, guys, so that's it for cognitive impairment disorders, specifically dementia and Alzheimer's disease. Make sure you check out the care plan and the patient story attached to this lesson to learn more. Now go out and be your best self today. And as always, happy nursing.